Scabies. Scabies has been in the news recently, and you might be wondering what that itchy rash might be. Now, scabies is an infection caused by the scabies mite, and it's passed on by close contact with somebody who has it. It can take about 8 weeks before somebody who has scabies begins to notice a rash, so it might be passed on while somebody is asymptomatic. The rash of scabies can be quite difficult to see, and you might notice itching, severe itching, which is particularly worse at night or when you're hot, for example, after a bath or after the shower. And it can be in particular places such as the wrists or around and in between the fingers. If there is a rash, it can often look like small red raised spots or little lines around the wrists, and it may look darker on darker skin. If you do have scabies, there are treatments available which include lotions and creams such as permethrin and malathion, and generally these are applied once and then again a week later. If you are using a permethrin cream, it's really important that you apply it all over the body, and by that I mean that you get some help to ensure that you cover areas such as the back of your ears, behind your ears, your back, and even using a cotton bud to get it underneath your nails. After your first treatment, it's also important that you wash linens, bed linens, nightwear, even teddy bears in a wash of 60 degrees. And if there are items which can't be washed, that you put them in a sealed bag for 3 days in order to kill the mites. There have been concerns that there have been a shortage of some of these medications, and also concerns about whether or not the mites are becoming resistant to them. But it may be that this is a pseudo-resistance because the treatment can be quite difficult to use properly. Even when treatment is effective, it's not unusual that itching can persist for a few weeks after treatment. There is another medication which has recently been licensed for use in the UK called ivermectin, which is in a tablet form, and that may be easier to take. Scabies is passed by close contact, and so the best way to avoid it is to avoid close contact of somebody that has it. But the difficulty is that you might not know that you have it for a period of time before the itching and the rash start to develop. It's also important to note that there is still a stigma around having a rash such as scabies, and that may stop some people going to the doctor or pharmacist for advice. And the only way to challenge that is for us to all keep talking about it. This is a common infection that can be treated. Remember, these videos are generalized medical advice and are not supposed to replace advice from your doctor. And if you would like to hear more health news and health advice, please visit www.thesun.co.uk/health or check out The Sun's YouTube health channel, The Sun Health.